plus statutes and statutory compliances, licenses that are all required. In one way or other way, we try to go through them and summarize. Now it is 5:51. The time is this one. Maybe in under 10 minutes we can complete. So because whoever is there, they all can relate. So it is covering about laws across patient care, everything that we talked about, infrastructure, we talked about lifts, we talked about fire safety, HR, we talked about minimum wages, we talked about age of employment, we talked about ESI, bonus, whichever, whatever things are applicable, yeah, hazardous, safe environment for the workers, employees, the kind of prevention of sexual harassment at workplace, the kind of protective equipment people should be having, and the kind of compliance with all of these things. So that is what we are talking about. So the very first line here may speak about that, summarize about it. So why so many laws? Hospital is a universe, no? They are kind of a mini universe. The patient is like home, is there 24 hours in a safe environment with a sound mind and a functional, healthy body. If such person is coming to a hospital kind of setup, where unknown people is extending the treatment with by virtue of their qualification and being employed in that particular setup, the structure should be safe, the equipment should be safe. So everything, the medicines what they use should be meeting the accepted kind of quality, kind of rigorous thing. The kind of patient 24 hour kind of care that is. So everything that is applicable to every organization, it will automatically applicable to hospital, and employees should be working in safe environment. What happened at Arjikar Medical College there at Calcutta, so it is not just in the patient perspective, it is perspective of the entire society, including employees. Historical evaluation, loss of historical evaluation, Hippocratic oath onward, do no harm, we're talking about loss of patient care, patient practical drugs, infrastructure, environment, HR, business. 10 मिनट लगेगा मुझे, आप भी वेट करो तो हो जाएगा. So my office closes at 5:30. Naturally, it is all, we're all extending hours. That is there. Staff will be coming in between. Last for HR and business operations. So business operations, say if you as a company, Apollo Hospital is there, every third month, quarterly, they will come out with their, the kind of mandatory requirement as a company, because the money they collected in the form of shares, the risk is distributed because everybody bought their shares. So public should know how their investment is giving returns. What is the status of the company? So even with one share also, you'll be knowing about the business operations of the listed hospitals. Listed could be Apollo is there, Narayan Hudalayan is there, Fortis is there. So now all these happen to be a kind of a business things. And if even if you are a charity hospital or a society, under a particular society, the hospital is running under the Society Act or Trust Act, again you have to. So law of medical, legal and safety, in one way or other way, there will be overlapping, as I said. Statutory complaint overview, clinical and facility licenses, all kind of licenses, Unified Healthcare Act, that is in the form of evolving kind of thing, I believe. So these are the kind of content. So the learning objective, major loss, category loss by areas of application, patient care. So this is one area regarding patient care, regarding infrastructure, regarding drugs, regarding HR, regarding compliance, which you are supposed to have. So time to time you are supposed to notify disease, you have to inform from your office, medical superintendent office. This is a compliance or not? Mandatory compliance under PCPNDT Act, you are supposed to provide this kind of data to the district health authorities. Under biomedical waste rules, this is the compliance, this is the data you are supposed to. So these are all your monthly in your checklist, whether these things are going or not going to the concerned authorities. Identify key license, from spirit license to all kind of license, narcotics we talked about, every kind of license. So with these many being there, how come that we can go for the unified civil law, something we talked about, civil code, something, 5 6 few years back we witnessed in Assam, certain states like that. Health is, why they are talking about is, health is under the state and central government both being there, and mainly being under the state government, and every state is having its own way of dealing with. So how come that you can have a unified healthcare legislation? Maybe that is a discussion here. Let us see. So the very laws are 200 are there. Then there's a guidelines. NABH, it is a kind of a voluntary kind of thing. Nothing prevents you. Uh, Nothing forces you to go for NABH, but nothing prevents you to adopt NABH as a reference guide in terms of patient safety and quality of services. Though you may not formally go for NABH, still that could make a beautiful reference. Then JCI, if you want to go for the medical tourism, all these kind of things, of course JCI is there. So anyhow, finally, any of the things not later settled by the penalized, it lead to a kind of a medical negligence facility wise or even patient care related wise, it may lead to penalty. So the laws will cover all these aspects in terms of hospital need to track all the laws touches, whatever we do that touches human life in one way or other way with immediate outcome or later outcome, which could be tracked and traced back to our act of commissioner who mentioned. So if laws are in non-negotiable regulatory, so that is there. So radiation, what kind of importance? Radiation is a, what is radiation basically? Atomic energy is a source of war. In the war, people use the atomic kind of whatever the uh, scope that is having to control the war to win the war. So the same radiation that you are using in a our medical domain for the patient care. So what kind of regulations AERB wise we should be following if you have a nuclear medicine or radio diagnosis or radiotherapy department. So what simple exclamation onwards. So that is about there. So telemedicine here, whose responsibility is what? So increased patient litigation. So that is always makes you to be alert with this kind of regulatory provision. Hospital employs hundreds of staff. So finally, it is labor intensive. Hospitals employs. Hospital is America among the employable population, employed people. 11% of American population are under the healthcare workers only. Whether it could be insurance company, whether it is a pharmaceutical company, whether it is a hospital, anywhere related to healthcare directly or indirectly. So health is always a multiplier effect on the economy. If you open a hospital which is offering 24-hour service, and if you are having a supervisor of with the same number of square feet, still hospital will be employing more number of people because the type of employees you need to have a plumber, you need to have a electrician, you need to have a AC technician, then you have a environmental engineer, you have a fire engineer. Within the engineering itself, you are talking about these many people. Then you talk about their assistant. Somebody is having a BTech, BE degree, somebody is having a diploma, somebody is having a ITI only. So numerous, like 200 laws applicable to the hospital, 200 different categories of employees are there within the hospital. Each of them is having, somebody is working at the generator. So his ear, whatever the kind of auditory kind of damage that can occur, later again it can be trackable to his employment related injury which occurred while they are employed with you. So many HR related issues are there. Accreditation bodies, if you go under accreditation, then automatically you are bound by this. So, but it is always at this point of time also, it is a voluntary only. Accreditation is not a mandatory. Okay, that we need to see. Then health, it is one and same. There in the first one we have seen Hippocratic oath, all the things that is there. So what is law? What is key provision? So MTP Act, PCP NDT Act, Transplantation of Human Organ, Mental Health Care Act, HIV, Right of Persons. So our hospital equal access, reasonable accommodation. So like AIIMS and all, they say how many toilets that you are having for the disability, differently able. Even you cannot say disabled. You have to say people differently abled people. There should be equal access. So the very constitution says, Article 17 we talk, Article 15 we talk about, Article 14 I believe. So right to equality. So people, that is not something somebody acquired, the kind of inability that is happened as accident or whatever. So still they should be having the access because healthcare is a kind of a right. So if you make a healthcare, if it is not accessible, if it is not made available, if it is not made affordable, if it is not acceptable, so then automatically there no point. So that's why here they're talking about person with disability, there should be access. Then last practice conduct of professional nursing council, dentist act, pharmacy. Then as a establishment, clinical establishment act speaks about your hospital to be registered. It's a mandatory kind of act. So one or two states, I think they're yet to adopt. So that's why unified law. Why we are talking about clinical unified law? So clinical establishment act will be having its own kind of a virtue, saying that a safe setting a hospital should be operating from. So if some states are not adapting, automatically what is the kind of trade-off? Something which we cannot imagine, that is patient safety. So that may be leading to this kind of nursing council act across India it is same, dentist act across the same it is same, pharmacy across India it is same. Then why not the clinical establishment? So these things may lead to this kind of. So now allied health professionals, all your physiotherapists, all your dietitians, all your laboratory technicians, they all 56 allied health professions, they are fall under the ambit of. So till today now you are looking at whether your doctor application, along with application you please submit, you have to enclose mandatory enclose registration with the state medical council or all India medical council, whatever the registration. So now you are going to ask your para professionals only, paramedical professionals also, apart from nurses and doctors. So otherwise, you are liable for uh, appointing, extending the care through non-qualified people. So as a hospital owner or proprietor, you are responsible. That is there. Then drug and cosmetic, as a narcotics, pharmacy act, how to store, how to procure, how to dispense, all those things are there. Atomic energy, electricity act. So electricity act, again, electrical safety related provisions in 2024, again government of India released the guidelines, electrical safety related provisions. Again, every hospital which is going by electrical safety audit under the NABH, they have to see that they are adhere with. So fire safety, petroleum, all these acts are there. So how much of oxygen cylinders, if you are storing, how you have to store them, vertically you have to keep them, with the chains you have to keep them. So all these kind of safety precautions that are incorporated. Human resource employees state insurance, it is applicable up to 21,000 rupees salary if somebody is working in an establishment. Though you say mine is a hospital, I extend free treatment to my hospital, that is not tenable. You have to have ESA covered and the organized patient employees, if whatever the number, more than 5 members or more than 10 members, as per the ESA, if they are employed by you, they all should be have a ESA. So because ESA is beyond health, there are five separate kind of benefits they get, including funeral benefit also. So that is a workman benefit kind of thing. It is not related to health alone. So then employee provident, gratuity, factories act, all the things. Then this is important. Internal review committee will be there. Sexual harassment of women. So come business and income tax, GST, Indian Contract Act, Right to Information, Consumer Protection, Information Technology Act. Then comes medical legal consumer Indian evidence. We talk about all kind of concepts and all. Code of criminal procedures. We talk about consumer protection, workman compensation. This is your employees. Again, it comes under HR purview. While employees, somebody they incur any kind of Prevention of Corruption Act. So this is applies to public hospital employees. Okay. So in the hospital, say there at the AIIMS, if a doctor is taken a private practice doing in spite of taking private practice, non-practicing allowance and indulging in all kind of things, so it attract prevention of corruption, like it attracts to any public functional government employee. So training research, this is to the bigger extent, bigger organizations. Patient safety, POSCO, domestic violence, all the things are there. Duty to report domestic violence. Say if somebody comes to your whatever your hospital, like your MLC, whatever the domestic, all the things we are supposed to. So hospital has to be prepared under Hospital Disaster Management Act. So that is also mandatory because government has invested on us. So that is there, I believe so. So statutory compliance, registration of hospitals, clinical establishment, shop and establishment. That is to do the business. This is to provide the service. This is to collect the bill and everything. GST registration, that is for filing the returns. Professional tax, as a professional tax, doctors we are paying whatever 200 rupees. That is all mandatory under this professional tax. So that is their labor law, ESA, biomedical waste, annual fire safety, NOC from fire department. So complaints on daily basis, instant reporting, waste segregation logs. So this is on the borderline instant reporting are best practices, kind of desirable practices. Maybe instant reporting means in the sense a patient commits suicide. Maybe that is a kind of a compliance kind of thing anytime required. Otherwise, regular instant related to our practice related, they are not the part of the legal compliance, our institutional betterment. So quarterly equipment calibration, fire drill, post training, all the things internal practice more of license renewals. These are all statutory. So as needed, new staff registration, any doctor, equipment additions. So all your ultrasonography because PCP and ET Act is applicable. That is very much there. So licenses required blood bank, pharmacy, radiology, dietary license, dietary FSI license is there. You are supposed to take ambulance, motor vehicle, like any other vehicle. Your ambulance has to be fire NOC, boiler certificate. The relevance, some of them may not be at this point of time. So if you have a dialysis, you have a endotoxin test has to be conducted, endotoxin test something. So your treatment plant NOC, specialty pharmacy, miscellaneous, radiology related, ARB in much bigger way with TLD badges to everything, all kind of safety precaution, pharmacy, all kind of licenses to procure, to store, and to dispense the cold, including cold chain, food related, previously medical gas not covered. So PSO, oxygen, NTO, all the things. This license speaks about because there is a potential explosions are possible. So biomedical equipment calibration, enable accredited lab. So equipment, if you need to safeguard yourself, you need to say your equipment is calibrated. That too by a NABL accredited lab calibrated. Compliance calendar. So you need to, as an administrator, you have to keep your fingers on that pulse, seeing that who is responsible, how frequently you have to, and when you have to. So this missed renewal can result in closure orders. So hospital can be closed if not compliant. So then there's a coming of Unified Healthcare Act for 200 fragmented acts. So these many acts are there. So outdated laws. Uh, so new things, digital health, telemedicine, everything is coming. So government is complying, maybe in the professional forums. So they want to come out with a unified law, proposed solutions, single comprehensive healthcare, at covering all healthcare provides uniform national registration. That is happening in one way or other way. Again, it is stopped in between. Dedicated healthcare uh, tribunals so that faster, quick resolution. So all the things are there. Clear liability framework for both protecting. So in one way or other way, it is there. They want to make it much bigger way. So Indian Medical Register, MBBS PG degree, obtain registration qualification from approved institutions. All kind of renewals again. What we are supposed to maintain as a individuals. It is talking about as a facility. Previously, we talked about criminal liability acts done with patient without patient consent. So our colleague, our one of the participant, he was asking, so which are the criminal liability? So if you have done without taking the consent, if that is resulted, uh, uh, maybe that is also protected if done for benefit of patient. So that is does not accrue any criminal liability. In emergency life-saving treatment without consent is still okay. Act of good faith, that is okay. So you action at reasonable kind of practice. None of these situations doesn't attract any kind of criminal liability. They are not talking about the harm that is done. That was the question actually. Death only if it is resulted, then only criminal liability is being applied or not. That was the question. Under IPC BNS, medical professional can be criminal liable, but law provides strong defenses. So under which conditions that we should be referring. So digital health telemedicine guidelines. So time to time new guidelines are coming because it is emerging kind of field. So Detailed Information Health Security Act, National Detailed Health Mission, ABDM. Under this only, we doctors, we are all getting all kind of our cells getting registered, getting unique numbers for our practice, apart from our existing NMC registration. Personal Data Protection, Robotics Guidelines, there are CDSCO drafting guidelines on artificial intelligence and machine learning, so even including the clinical trials. So key takeaways, so multiple laws applicable and all the kind of licenses that is mandatory. Then people who are working, it is all the registration, professional body registration, non-negotiable. New frontier in terms of digital health, whatever it is there, we all should be ready with and comply with. So it all leads to come out with a unified format of one place for us to refer, single window system for reference and doing and comply with, and to know and to come out with some level of betterment. So that must be the idea. So these are the key takeaways. So this is a summary. With this, I believe it is completed, and I wish the discussion regarding entire unit, this particular unit and entire block we can have for the next whatever the time that is you require. My presentation is completed. Good evening. Please start, one of you among the participants, learners.
Yeah, thank you so much, sir.
Madam.
Any learners or participants, they have any questions, so they can ask, sir.
So if I go to stop share,